Childbirth today is one of the most medically managed events in a human life. Monitors, surgical teams, pain medication, blood transfusions, neonatal units, and even with all of that, it still carries real risk. So when you strip all of it away and ask what birth actually looked like for a woman living 50,000 years ago, or 200,000 years ago, or further back than that, the answer gets complicated fast. Because this isn't just a question about medicine, it's a question about anatomy, evolution, social structure, and a biological contradiction that our species has been navigating since before we were fully human. The short version is that giving birth is harder for us than for almost any other primate on the planet, and the reason why goes back much further than anyone usually expects. Start with the mechanics. A human baby's head is enormous relative to the birth canal. That's not a minor inconvenience. It's a significant structural problem that every mother in human history has had to work through. A chimpanzee gives birth with relatively little difficulty. The infant's head moves through the birth canal facing forward and comes out cleanly. There's no rotation required. The infant basically slides out in a straight line, and the whole process, while still painful, is far shorter and physically less complicated. Human birth involves something different. At some point in our evolutionary past, two major changes happened in the same body at roughly the same time, and they pulled against each other in ways that created one of the more unusual biological situations in the animal kingdom. The first change was bipedalism. When our ancestors shifted from moving on four limbs to walking upright on two, the entire structure of the pelvis had to reorganize. Efficient two-legged walking requires a narrower pelvis, with the bones angled inward to keep your center of gravity stable. That works well for locomotion, but it shrinks the opening a baby has to pass through. The second change was brain size. Over millions of years, the hominin brain expanded dramatically. A bigger brain means a bigger skull. A bigger skull means a larger head. So you have a birth canal that got narrower at the same time the thing passing through it got larger. Researchers have called this the obstetric dilemma, and it shaped nearly everything about how human birth works. Because of this mismatch, human infants have to rotate during delivery. The head enters the canal facing one direction, then turns partway through, then exits facing the opposite way from the mother. This means a mother instinctively reaches down to guide the infant out, but she's reaching toward the back of its head. The infant is facing away from her. That single anatomical fact has enormous implications. It means that for most of human prehistory, giving birth alone was genuinely dangerous. A woman who had no one there to receive the baby, to check for a cord around the neck, to clear the airway, was in a far worse position than almost any other primate giving birth in the same forest. Assistance wasn't a luxury, it was something the body had evolved to need. This is where the social side becomes inseparable from the physical side. Anthropologists have a term for it: cooperative breeding. Humans are unusual among primates in the degree to which they rely on others to raise offspring. That reliance doesn't start after birth. Evidence from modern hunter-gatherer societies, which are the closest living model we have for how ancient humans organized themselves, shows consistently that birth is attended. Older women, experienced mothers, sisters, close female relatives. The presence of others during labor isn't a cultural refinement that came later. It appears to be a deeply embedded behavioral pattern that goes back a very long time. What happened during a birth 100,000 years ago would have looked, socially, more like what happens in a traditional birth attended by a midwife than like something a woman managed on her own in a field. Now let's talk about what that actually looked like in practice. There were no hospitals. There were no sterile instruments. No synthetic oxytocin to speed contractions. No way to perform a cesarean if labor stalled. What ancient women had was knowledge. Accumulated, transmitted, practiced knowledge about how birth worked and what to do when it didn't go smoothly. Archaeological and anthropological evidence suggests that plant-based medicines were used far earlier than most people assume. Neanderthals, who we know buried their dead and cared for injured group members, were almost certainly using plants with medicinal properties. Some researchers have pointed to residue evidence suggesting yarrow and other plants with pain-relieving or contraction-stimulating properties were in use before anatomically modern humans even appeared. Let's talk about pain management specifically. The idea that ancient women simply suffered through labor without any attempt to ease it doesn't hold up well against what we know about human behavior. Ethnographic records from hunter-gatherer groups around the world, collected across the 19th and 20th centuries before those societies changed significantly, document a remarkable consistency in birth practices. Certain plants were used to regulate contractions. Specific positions were encouraged. Some groups used heated stones placed near the lower back. Others used rhythmic movement, massage, or immersion in water. None of these required agriculture or permanent settlements. They required only observation, trial, error, and the passage of that knowledge between generations of women. Posture is another detail that gets overlooked. The flat on your back position that became standard in Western hospitals is actually one of the least anatomically efficient positions for delivery. It was largely adopted because it was convenient for physicians, not because it made birth easier for mothers. Anthropological records suggest that ancient women gave birth upright far more often, squatting, kneeling, or supported by other women from behind. Squatting increases the diameter of the pelvic outlet by as much as 28% compared to lying flat. That's not a small difference. For a birth that's already working against tight margins, 28% is the difference between manageable and catastrophic. What about infant mortality? This is where the numbers become sobering. Estimates based on skeletal evidence from prehistoric populations suggest that somewhere between 30% and 50% of children in early human societies died before reaching adulthood. Maternal mortality during or after childbirth was also significant. Pelvic fractures, infections, hemorrhage. Without the ability to stop postpartum bleeding quickly, a delivery that would be considered routine today could be fatal. Researchers examining ancient skeletal remains have found evidence of pelvic stress injuries consistent with difficult deliveries. Some remains show healed fractures suggesting the woman survived a traumatic birth, but likely with permanent consequences. Here's something that often surprises people. Human babies are born earlier, developmentally, than almost any comparable primate. A newborn chimpanzee can grip, cling, and hold itself upright within hours. A human newborn can do almost nothing independently. The skull is still open at the fontanelles, the soft spots, because if the brain were any more developed at birth, the head would be too large to deliver at all. Humans essentially complete a portion of their neurological development outside the womb that other primates finish inside it. This is sometimes described as a fourth trimester. It means that a human infant requires an enormous amount of external support for longer than any other primate infant does, which loops back to why the social structure surrounding birth was so critical from the very beginning. Now let's talk about what birth looked like for earlier species in our family. Homo erectus had a pelvis that was narrower than ours in some respects, but their infants also had smaller heads. The obstetric dilemma was less acute for them, though not absent. Some researchers believe that the rotation characteristic of modern human birth may not have been necessary for Homo erectus at all, meaning their births were closer to what you see in great apes today. Neanderthals are more interesting. Their pelvises, reconstructed from fragmentary remains, suggest their birth process was more similar to modern humans than to Homo erectus. A Neanderthal infant's head was large enough to require assistance during delivery, which means Neanderthal women almost certainly relied on each other during birth in much the same way modern humans do. One of the only mostly complete Neanderthal pelvis specimens, found at Tabun Cave in Israel, indicates a birth canal shape that would have made unassisted delivery very difficult. That single fossil says something significant about Neanderthal social life. A species that could not safely give birth alone was a species that had to maintain social bonds strong enough to ensure someone was present when birth happened. That kind of mutual dependence changes how you think about Neanderthal groups. It pushes back against the old image of isolated, solitary brutes and towards something that looks more like a community with genuine interdependence, especially among women. The survival rate for ancient births would have varied significantly based on factors like nutrition, age of the mother, and whether previous deliveries had caused lasting damage to the pelvis. Very young mothers were at higher risk. Malnourished mothers whose pelvic bones may not have developed fully faced additional complications. Populations under nutritional stress, during cold periods or after major prey extinctions, likely saw spikes in maternal and infant death that would have been visible in the demographic record. Some researchers believe that the periods of population bottleneck visible in ancient human DNA, moments when our ancestral population appears to have shrunk dramatically, may reflect not just deaths from violence or starvation, but cascading failures in reproductive success. Something else worth noting is that ancient humans almost certainly recognized the signs of difficult labor and had frameworks for responding to them. Prolonged labor, abnormal positioning, a cord around the neck. These were not invisible to experienced birth attendants. The specific knowledge of what to do, which plants helped, which positions shifted the infant, how to manage hemorrhage with pressure or packing would have been among the most valuable knowledge a community possessed. It was worth teaching carefully and preserving across generations. In that sense, the woman attending a birth 80,000 years ago in a rock shelter in southern Africa carried with her a body of practical expertise that had been refined across thousands of years of accumulated experience.